Hello there, I'm Miranda Gretton, and this is Take a Moment with NCHC, the show where we talk to you and your colleagues about experiences that affect you. Listen on your drive between patients or in your downtime, whenever you get the chance to take a moment.
Hello, I'm Zoe Carroll. I'm an AHP clinical educator and I sit across the education and workforce teams.
Hi, I'm Jemma Spencer. I'm a Band 5 Physio. I did the rotational programme for about 1.5 years and I've just recently moved to a static position within the Trust.
Hi, I'm Kat Alexander. I'm an occupational therapist. I've been on rotation now since June 2020 and I'm about to enter my 5th rotation.
Zoe, can you give us a little understanding of what exactly being on rotation entails?
Being on rotation, at the moment, our trust offers a rotation programme for our Band 5s and is very popular with newly qualified therapists. And what it entails is going to different specialties and areas of work for set periods of time. And it gives you that opportunity to experience different specialities within the professional field.
So, Kat, going into your 5th rotation, then you're obviously enjoying being on rotation. What do you prefer about being on rotation to being in a static OT post?
So, yes, obviously, with any role, there are advantages and disadvantages. And obviously, some people might say to me, yeah, but isn't it hard restarting a new role? It's like restarting a whole new job. And yes, sometimes it is, but we've got things in place for that. So, we've created a rotation passport, which comes with us that if we want to fill in, that helps our new managers understand what skills we already have and gives a little bit brief background to, who we are and any reasonable adjustments that we need. And the thing that I really enjoy, and the reason why I've stayed on and I am about to enter my 5th, for every role, you're learning something new. And as an occupational therapist, it's so broad that you kind of need to, whilst you're a Band 5 and you've got that support, get as much experience as you can so that when you do decide to become a Band 6, you feel that you're very ready to become your own Band 6. Because on a static post, yes, there'll be advantages, as I said before, you can get to know your team for longer and all of those kind of things, but you'll be under the same person who might have been in the role for a very long time, who it works in a very specific way. And whereas every time you move, you get to learn a little bit more about a different way of working, which will kind of build on, you can take bits and pieces from each supervisor that you have. So you might be like, that's a good thing from that person. I won't do it like that from that person, but I'll take that from that person. I feel that it's not just your clinical skills you build up, it is your personal skills, because you see things in a different way and a different perspective each time you rotate.
So, from a professional perspective, it's almost like a try before you buy. You can have a little look around all the different areas and think, actually, what I thought I would love, actually, I love something different and I want to go on a different path.
Absolutely. I mean, I was told, because I had neuro experience as a senior rehabilitation assistant, I was told by my university lecturer, she was like, no, you don't need to do a rotation, just go straight in. You can do that straight away. You're good at this, go and do it. And I was like, maybe. And then I did a placement in the social services team. And that's where I met a lady who was on the rotation, and she was explaining it to me. And I was like, actually, the fact that I really like the placement, I didn't think I would like social services, but actually, I really liked the placement I was on. And then I was like, okay, so it has the one that I like, it has neuro. In this one. So actually, this will give me the best opportunity to get 3 different types of neuro, and it will get me the opportunity to see social services and lots of other opportunities as well. So that's why I applied for the rotation, because like you said, actually I've met people that thought, oh, wheelchair services, doing wheelchairs all day, that would be so boring, why would I do that? But actually there's been 3 people that ended up working there static because they loved it so much. Each time you rotate, you put 3 choices down, and then you will be selected, obviously, hopefully one of those, which so far I have had all of my ones I put down have been one of my choices. And, I know people that have gone, oh, I've got my third choice, but actually they've jumped into that role and gone, I kind of want to do it again.
Well, that was going to be my next question, actually, like, about the choices. That's so interesting. So you get to put down 3, but let's say, Zoe, for example, if someone was to come to you and say, I've put my 3 choices, but I've got my third choice and I'm really upset about it, I don't want to do that placement. Is there a bit of flexibility, or, are you kind of sort of funneled in because of where the trust needs those posts to be?
We absolutely always try and be as flexible as we can, and we try and give as much variety with our areas as possible. And we really try to listen to feedback as well. So if there's particular areas where people are really interested to be included on the rotation, then we absolutely try and include those. Obviously, that may not always be possible, but as placement managers, we do try and maintain a really positive working relationship with all our band 5s, and really do try and take any feedback on board to make sure that it's as positive experience at the start of someone's career as possible.
So, Gemma, you've moved out of rotation and into a static post. Did you do what Kat's describing, that you went into one of those kind of 3 choices and then thought, I love this so much, I want to do it for static? How, what's your journey looking like there?
I ended up actually covering 4 different locations, even though my last one was quite short. So yeah, I think my first one was on a ward, and then I went to Wyndham Community, and then went into the Integrated Therapy Partnership, which is your MSK outpatients. And whilst I was there, I really liked the MSK outpatients, but to be honest, I loved all of them. I loved all of the rotations. And I say a static position came up. It was actually a rotational static position. So it's static within the Integrated Therapy Partnership, but they brought out a rotational post. So doing biomechanics, hand therapy, and physio. And because of how much I loved the rotations, I sort of realised how much I valued that broad range of experience. So although felt like I wanted to narrow my scope a little bit, I still wanted to keep that broad rotational aspect to it. And even after getting that position, I still asked to go to my next rotation for a couple of months that I'd already been offered, because I just felt like that experience, it was about 2 months with ESD, would have been so valuable. And I'm really pleased I went before sort of moving over to the Integrated Therapy Partnership as more of a static position, because it's just the broad range of skills you get and the transferable skills you get is just second to none, really.
Well, that's it. I mean, professionally, because of all of that broad range of skills that you get, it's got so many benefits. But I can't help but think, I mean, maybe this is just my personality, but personally, I would probably struggle with going, get to know people, get settled, and then you're obviously moving on. Do you think you have to be a certain type of person, you have to have a certain personality type to be able to cope with that kind of moving on constantly?
I don't think you need a certain type of personality, because a band 5 is all about development. I mean, I'm I'm someone who hates change, so it's a bit ironic that I was in a rotational post, isn't it? It's difficult because you do get attached. I've made some lifelong friends in all of the rotations, so it is difficult to move on when you get really settled. You do get almost so settled that you want to stay. But I would say it really does develop your resilience. I mean, I feel like I'm a completely different person now than when I started, because that adaptability you gain from changing posts and actually getting used to working in a completely new location, a completely new role with new people. And it's been nice to see that actually it's taken me less time to settle with every rotation I've been on. And I'm much quicker at responding to those sort of changes. And it was interesting because I've even been told by a manager at one point that they can tell who's been on a rotational versus who went straight into a static position as a junior and who has done some rotations, because of those non-clinical skills that you perhaps don't get in a static position, or I don't get as much of compared to a rotational when you're forced to adapt to those different circumstances.
That's really selling it. I think if anyone was listening and thinking, oh God, I don't think I could do that change, to hear that you were someone who's a bit adverse to change is actually really, really interesting. So, Kat, why did you choose to do your rotation with a community trust rather than, say, going to, I don't know, the Norfolk and Norwich or one of the other acutes?
A couple of reasons, really. One of my main reason is that I I just knew that I'm better in the community than in a hospital. As I said, I have had a community hospital experience. It was okay, but I knew it's not for me. And that, I think that's really important to know, is that the range of experience from being in the community, and actually, as Jemma said, touching on those skills that you don't necessarily learn as clinical skills, but things like the fact that you're alone working when you're in the community, you build up quite a lot of personal skills that are good for development for future jobs. And so I think it's a personal choice, as well as kind of just for those that are wondering, but if you're alone isn't that scary, but actually you've got so much support back at base that you're never in a situation where you're going to be, in a bad decision making situation. You're always going to have that support. So it's not like, you're going to be left to deal with something that's out of your clinical range. And then the other reason is actually looking at NCHC, I knew that they were outstanding, and there was a lot of information about how they're good towards staff. I read during my interviews, I read information on how the leadership promise was, and actually that was really important to me, because I know in a busy setting like acute wards, you don't always get that same support from the leadership in that way. And I just didn't feel when I was on placement in an acute that same support was there. So I knew for me that I needed more of a better management system. But as I said, there are going to be people that actually quite like the fast pace of an acute and they want to go there. But for me, I knew community was what I wanted.
So it's listening to yourself and being true to what you're trying to achieve, I suppose, as well in your career. You need to look at where you want to be, what you want to be doing. But I guess that's the beauty of the rotation, is that you can do lots of them, or you can just do a couple, and then you can almost end up where you're meant to be.
What I loved so much about the NCH and C rotations is that they're so broad. So actually you can get ward experience, you can get community experience, you can get outpatient experience. And you could argue that sort of versatility isn't offered in an acute trust because you're always in the same place and they're sort of ward based or outpatient. From speaking to people who work in the acute, because the pressures are different, I've heard that it's more assessment based. Whereas personally, I felt that I wanted to work with people longer, get that sort of rehabilitation side of it. And in the community, arguably, you get longer with people. They sort of stay on the caseload for longer. You can see change, or more change that you would see perhaps in an acute when you've got to discharge them quickly, which I found as more fulfilling in general. But for those people who think that, oh, I do want to be on a ward, it's worth remembering that actually the community trusts do offer ward-based experience. And if anything, based on sort of my student experiences, I preferred the ward-based experience in the community because you had more time with people. It wasn't a case of, oh, what's your assessment? Or you assess them, okay, what discharge planning are we doing? Are they short-term bed? Are they this? Are they that? It was, okay, what do you want to achieve whilst you're on this ward? What do you want to work on? And you could work, it was more rehabilitation focused rather than just assessment.
And I presume it must be really beneficial to the teams that you're going into as well, because you're a fresh pair of eyes. You bring all of that experience into that team. So for you personally and professionally, it's great. It's loads of benefits. But for the teams that you're going into, it must have loads of benefits as well.
Yeah, I mean, like I said, you gain transferable skills wherever you go. So, as an example, I did the community rotation and then I went to the integrated therapy partnership. And one thing that I noticed in the community was obviously falls referrals come in and sometimes they're not massively appropriate and things like that. And actually, when I went to the integrated therapy partnership, there were people there who didn't really know when to make a falls referral, when's it indicated, and actually I was able to use that experience that I'd got from working in the community and actually being on the other end of those falls referrals to say, okay, well, this is when they are indicated, this is when they're not. And actually that was within a few days of me being there, and I was able to contribute and bring something to that team.
That's so valuable. We're always talking about how we need to be sharing learning across the trust, and that's just such a great way of doing it.
It's the same with being able to go into social services. You hear a lot in some teams where it's like, oh, this person should be social services, not for us, and blah, blah, blah. And actually being able to go out to social services has been really valuable to know what they do and what is appropriate elsewhere. And also because the team I'm in is an integrated team, to see how well that works. And that could be something that could be discussed within some of the other areas where it's not integrated.
Zoe, can you tell us then, if someone's listening to this and thinking, oh my goodness, I didn't know, either I didn't know this existed and I really want to try it, or I've always wondered and these guys have just sort of convinced me that I'm going to try. If I want to go onto rotation, what can people do? What's the first step?
So the first step is very much to look out for our adverts. They can be found on NHS Jobs and on our website. We often have job adverts out, and we really encourage, much as we, support our band fives, we really want them to progress and see them striving in their careers. So we often end up having vacancies from people moving on with all of those fantastic skills that they've gained. So do keep an eye out for our adverts. You'll then be invited to interview should you meet our person spec criteria. And we pride ourselves on being a really friendly and approachable team. So please do get in touch to talk to us about it if you'd like to know a bit more.
I would really encourage anyone to go out onto rotation when you first leave university. You might be sitting there thinking that you know what you want to do, but from someone who's been through it, I don't personally feel that the experiences you get at university are a true reflection of what the different locations of work are like out there. And this is something you're probably going to be doing for the rest of your life. So take the different experiences whilst you can, get as much experience when you can, and then you can always chop and change and go from different disciplines once you've got that experience.
Thank you for listening to Take a Moment with NCHC. If you've enjoyed this podcast, please visit the podcast intranet page to leave a comment and for details of our other episodes. You can also follow NCHC on all social media channels.